Good morning, students. Today we will be discussing about, let's try to understand what cognitive behavior therapy is. Yesterday we have learned what is psychotherapy, psychoanalysis, therapy. So today we will be discussing a bit on cognitive behavior therapy or CBT. I have spoken a lot about CBT in our posting in the class on substance use when we're doing the treatment modalities. So now let's try to understand what CBT is all about. Please try to understand. This class will also apply for the other subsequent like anxiety disorder, personality disorder, okay, and the other it is one of the treatment modalities of the other mental illness too. Now let's try to understand what CBT is. Now CBT is a type of psychotherapeutic treatment, okay. It is part of a psychotherapy. What psychotherapy is all about? Yesterday, let's just try to review the phase we have. There is the ventilation phase or the catharsis phase. After there is ventilation and there is catharsis by the client, the therapist make the interpretation, or it can be or he can even do the analytical interpretation, right? And then it goes to the other next phase where he gives the re-education or the educative part that we help the patient how to cope with it. Now, so CBT is a type of psychotherapeutic treatment that helps patients understand the thoughts and feelings that influence behavior. Now, please note this point: cognitive. Okay, cognitive. There is a word cognitive. Cognitive has got to do with our perception. Cognitive has got to do with our thinking. Cognitive, okay, in the psychological realm. Right. Now, over here we have another word which is behavior therapy. Behavior therapy is the action of the client or of an individual. Behavior is how I respond, in what way I respond. What is my behavior? It can be a positive behavior, it can be a negative behavior, it can be a behavior which is adaptive a behavior, or it can be a maladaptive behavior. Now, so CBT is cognitive behavior therapy. In the other class after this, if we have time, we will be discussing about behavior therapy. Now, behavior therapy is only a therapy which we help the client to change, to bring about, to replace the maladaptive behavior with the adaptive behavior through the again through the therapy, through the process of modeling, through the process of condition, okay. All those are there which we will be seeing it now. CBT is cognitive behavior therapy. So what is this? This is a type of a psychotherapy. What does it do? It helps the patient to understand the thoughts and feelings. Over here, the main goal is a client should have insight over what his thinking is, over what his perception is, over what his feelings or attitude is that influence the behavior. This school of thought believe that, okay, this therapy believe that every behavior is influenced by the perception and thinking of a person. So it believes that if we want to bring about a change in the behavior of a client, we have to work with the change in the cognition level, in his cognitive level. Because if the deeply seated thinking level and thoughts, from where does this deeply seated thoughts and feelings come? From our thinking. Now, what governs our personality? What governs our ego, superego? These stages of life, right? And how do we understand this? Sigmund Freud have explained it through the psychosexual. Erik Erikson have explained it in the Erik Erikson personality development. And we learn through modeling, we learn through condition, how we condition ourselves. So all these gets deeply seated. Now this one influenced the behavior. So it says that if we want to change behavior, we have to change the cognition of a person. So that is basically what CBT is. So CBT is commonly used to treat phobia, addiction, okay, depression, and anxiety. Now from this we have seen about this. We know that these stem from inside, the psychodynamic, the psychopathology, from the either the biological point of view, the psychological point of view, and the social point of view. All these we will understand that it stems right from the deeply seated thinking, right? See, we have studied in substance, right? Sometimes to bring about the change in the addiction, we have to change the cognition. Cognition means we change the thinking, the reward pathway of the rewarding of a client, right? Depression and anxiety. Now let's continue. So CBT is generally short term and focus on helping client deal with a very specific problem. That's why not all clients are a candidate for CBT. Those clients which have deeply seated problem, these deeply seated where their thinking only is the way they perceive things only needs to be addressed. The problem is not with their behavior, the problem is because the way they perceive, the way they think, the way they feel about things, that influence the behavior. So once we change this, definitely the problem will be addressed. So it though it says it is short term, but from my own experience and from my other colleagues and the other person who is giving a CBT, it depends from person to person. Sometimes because we need sessions, right? Sometimes it can be addressed at a very short term, and sometimes it does take long. But usually, most of them, if the problem is specific, once we deal with that, the problem gets solved. Now, during the course of treatment, people learn how to identify and change destructive and disturbing thought patterns that have a negative influence on behavior. Now, remember, a person who requires CBT is a person who have maladaptive behavior. That means those behavior which disturb the everyday functioning of a person, or those behavior that brings about a change in the what do I say, in daily life management of a person. Now, so what will the behavior will be disturbing only when it is maladaptive in nature. So if the behavior is maladaptive, that means the thinking, there must be some destructive or disturbing or negative thinking pattern that a person has. So what the CBT does, a person who gives CBT or a therapist help the client to analyze and to find out what are his ways of thinking and what is wrong in his thinking and perception that bring about the behavior. Now, so the underlying concept behind CBT is that our thoughts and feelings play a fundamental role in our behavior. I think you've understood this. The goal of CBT is to teach patients that while they cannot control every aspect of the world around them, they can still take control of how they interpret and deal with things in their environment. Now, again, to understand this, you go back to that first class of mine. Okay, the first class, the introductory class where we studied the biopsychosocial model. We as a person, we have our own physical setup and our own physical makeup, right? And we also have our own, me as a person, I have my own psychological makeup. The same thing with you. And me, with my psychological makeup, I have the environment or the social-cultural makeup around me. My social, my cultural, sorry, my social cultural makeup may be different from yours, right? So what happened? though we could not change we may not be able to change the environment because we are in constant stresses. Okay, there are many stresses that are constantly influencing and affecting us. So how we respond to it, right? How we respond to it, that is what CBT helps in teaching the client to understand with their perception, their thinking, and their response. Thus, they can adapt in their everyday life in a better way. Okay, now, so why CBT is needed? This is given by Beck et al. In 1979 from this literature says negative emotions are elicited by cognitive process developed through influence of learning and temperament. How do we learn? We learn from the minute we learn right from our mother's womb, then we learn during all those stages of life, right? All those influence directly or indirectly our thinking and our perception and our temperament. How does our temperament develop? Temperament develop again in ego superego. How do we handle the different topography of the mind, and how do we deal with our defense mechanism, and how do we cope, and what is our primary coping strategies, what is our secondary coping strategies, and how do we deal with it. All these influence our learning, right? Now, so when is the response negative? Again, because we have faulty learning, right? Now, so adverse life events elicit automatic processing, which is viewed as a causal factor. Cognitive trait, negative automatic thoughts center around our understanding of ourselves, others, and future. Okay, this has got to do more with us understanding ourselves. Right now, it focuses on examination of cognitive beliefs and developing rational responses to negative automatic thoughts. Now, why are these? Why does we have see this word? Negative automatic thoughts. Negative automatic thoughts are those thoughts. Why it is automatic? Automatically we think in this way. Automatically we respond in this way. Automatically we behave in this way. Why? Because already we have conditioned, our mind is conditioned to behave like that. How does conditioning takes place? Go back to classical conditioning and understand how does it happen. Go back to open conditioning, and then we learn through role model. Maybe we grow in an environment where everyone learn to cope this way. That model our thinking and our perception and our response, or the daily life experiences as we go through our stages, how we life experience that only taught us or condition our thinking in that way, right? So these are called automatically. Once they are deeply seated, automatically, say we will behave in that way. Right. So let's go ahead. So the cognitive specificity hypothesis. This is a research article which I thought you'll be able to understand. Distorted appraisal follow themes relevant to the specific psychiatric condition. Psychological disorders are characterized by a different psychological profile. Depression. From where does this depression come? Okay, well, what are the depressive behaviors, or the signs will come? Negative view of self, always negative about others, always negative about the future. So, why will a person always be negative about everything? It is because a person is always the core belief or the core thinking or the automatic belief, the cognitive belief is always associated with I am helpless, I've always failed, I am incompetent, and I'm always unloved. Right, so these are deeply seated. So automatically, these will influence the response or the response to the situation in the psychosocial realm. Okay, now in anxiety, what comes out from the behavior? Anxiety, overestimation of physical and psychological threats. Why people have anxiety, why some don't have. So what happened? The core belief is, that means the core belief. What do you mean by core? Core is that innate, those deeply seated thinking. Okay, the core, we call it core strength, the main pillars. Okay, the core belief linked with risk, dangerousness, and uncontrollability. Already we have a thinking, oh, this is risky. So we are anxious. Oh, this is very dangerous. So we are anxious. Oh, I cannot control. This is beyond my control. Automatically, anxiety stem in. When there is a lot of anxiety, so automatically our view towards ourselves, towards the situation, will never be positive. It'll always be negative. So that's why these are the hypotheses which is specific why we need to change the cognition to bring about the change in the behavior. Why we need to bring about a change in the behavior? Because only then a person will be, if the person changed the cognition, definitely the patient will be able to behave in a better adaptive way. Okay, now, so cognitive specificity, another 5 minutes. We will see the negative trait associated with depression. I've taken these two symptoms because all of us have understood and we have seen patients also. The cognitive trait, there's always a trait: myself, others, future. Remember this trait: myself, others, future. Myself, I always think, cognitive thinking, okay, negatively. I am incompetent and I'm unloved. Others, they view others, people, they never care about me, pity me. They don't even care. Okay, nobody likes me. Future. So my view, my thinking of the future definitely will, my future is bleak. Why? Because already me, myself also, I am thinking I'm not competent. And others also don't like me or they don't care about me. So the future is bleak. Now let's that definitely it will go to all that low mood, depression we all know, low mood, low psychomotor, right? And then the speech also, we will not the speech also will be less, and we have hopelessness, helplessness, worthlessness. All those will be there. From where does this stem? They stem from the negative thinking that we have about this. Now, the negative trait with anxiety. Now, why is a person anxious? Now, the thinking of myself is I'm not able to protect myself. So it will add up to more anxiety. Others, we are anxious. It, the thinking for others, people will always humiliate me. Oh, if I go, what will they say? They will see, they will always humiliate me. Future, it's a matter of time before I am embarrassed. They think what anxiety is, what? Anxiety is there is an impending fear or feeling which is not there. Thinking ki jo hone wala hai. Right. So all these thoughts you think, why do you have? You yourself, you feel you're weak, you're incompetent, you cannot solve things. Others will humiliate you. Right. And in no time I will be embarrassed. So these are the trait which brings out the cognition, the faulty cognition related with anxiety. With other different disorders, different we have with OCD, obsession, appraisal with obsessive cognition, anorexia. Anorexia deal with control, word, perfection. When we will study anorexia, that time you will understand better. Panic, catastrophic misinterpretation of physical sensation. Again, how do you misinterpret? Again, self, others, future. Paranoia, we have problem with trust. We have problem with vulnerable. We always feel we are vulnerable. Okay, we're always suspicious, right? So these are the cognition which needs to be handled for the disorders. Now, how does the CBT work? Okay, see, events are there, appraisal is there. Appraisal is how we relate to it. Then affective and biological arousal. That means we relate to it, we think in this way, and as we think, our body also responds in that way. Then we behave in how we think. Thus, it produces maladaptive behavior. So, if we want to change this behavior, we have to change in the way we appraise. Okay? Once we change here, definitely the response will change here. This leads to the change in the behavior, and definitely it will bring about an adaptive behavior. Then any event, subsequent event, a person will be able to respond in a better way. Okay, so let's see what is. We will understand. I think that has come. Um, in the how does this cognition thing, okay, let's take for example, Bill goes to collection, okay, appraisal. I can never do anything right. Already he's thinking. Let's take for example the event, okay. Already he thinks he can never do anything right. Because he already thinks that he can never do anything right, so what is his body response? Low energy, disruption of sleep, increase in fatigue. So definitely this, already he has this will influence. I don't want to deal with it. I don't have energy. Nahi karna mere ko. But then you will find it's too distressful to think about it. So the behavioral inclination will be there. So inclination, the thinking, okay, behavioral thinking. So because you already have thinking of this, so what happens? You will avoid, you will withdraw, you will not do it. So that gets manifested in our behavior. So you have an event already, it triggers your thinking. Now, from where does this thinking come? This is already deeply seated thinking that had come from the triad self, others, future. Already you have thought in this way, you have conditioned your thinking this way. So this leads to your biological realm, this one. Psychological, we think this way, and then we, depending on what we think, we behave in that way. So to bring about a change here, we change in this. Okay? So that is what CBT is all about. So what are the automatic thoughts? What was going through your mind? It happens spontaneously in response to situation. See, stressful situation. Oh, I'll just end it. A stressful situation, we all have our automatic thoughts. Okay, sorry. We have our automatic thoughts, and then we have our negative emotions. Right. So from this, I think I will continue in the next class. Otherwise, you will not be able to relate to the subsequent classes. So, so has come. I will stop my class here. In the evening, if we have class, we will continue with this. Okay. Thank you, students. Please stay connected and attend this class.